Welcome to No More Excuses. There are many questions surrounding the effects of alcohol on your body and brain. These can include slow reaction times, slurred speech, and blurred vision. These symptoms can be dangerous, and preventing them is vital to your and your family's health. In today's video, we will discuss the effects of alcohol on your body and brain. Please help support the channel by liking and subscribing. Now let's get back to the video. How does alcohol affect the brain? Alcohol changes the levels of neurotransmitters in the brain, which help to control behavior and emotion. These chemicals are also crucial in regulating physical activity. When they're depleted, the brain can't produce the chemicals it needs to function normally. As a result, alcohol can be detrimental to brain development and function. Scientists have used PET imaging to study the effects of heavy alcohol consumption on the brain. They've discovered that heavy alcohol users have deficits in the frontal lobes, which are responsible for learning and memory, and the cerebellum, which controls movement. With this technology, they've been able to analyze the effects of alcohol on brain cell metabolism, blood flow, and other factors. The effects of alcohol on the brain are largely short-term, but the long-term damage is more serious. Alcohol damages the hippocampus region, which is responsible for memory creation. Repeated alcohol consumption can damage this region, leading to short-term memory loss and brain cell death. Moreover, it can inhibit the formation of new memories. Slowed reaction times. Alcohol can affect the way we react to certain situations. Specifically, it can interfere with our body's ability to produce ATP, the energy fuel that all our cells need to work properly. This decrease in ATP can cause a lack of energy and decrease our endurance. Even small amounts of alcohol can lead to slower reaction times and decreased hand-eye coordination, which can increase the risk of an accident. In addition to the effect of alcohol on reaction times, it has also been shown to affect the way we process information. We're not yet sure how alcohol impairs information processing at all stages, but it can impede cognitive abilities and affect simple reflexes. Alcohol can reduce our reaction time by as much as 120 milliseconds. The same effect occurs even if we don't drink to the legal limit. At 0.08% BAC, we're still slow compared to our sober counterparts. This means we're less likely to respond to a potential collision and risk a car accident. Slurred speech. Alcohol causes slurred speech because it interferes with brain activity, slowing communication between the brain and the rest of the body. Alcohol also affects the brain's Purkinje neurons, which control muscle memory and coordination. Alcohol causes slurred speech because it suppresses the production of glutamate, a chemical that promotes excitement and energy. Slurred speech can be an early sign of a stroke, a condition in which a blood vessel has become blocked. If you have a bad experience with alcohol, please share your story in the comments. When this occurs, the brain is damaged, and the patient experiences the symptoms of a stroke. Slurred speech is often one of the first symptoms, and it may take weeks to realize the full extent of the damage. People with a BAC of 0.1% or higher experience difficulty forming words and sentence formation. They also experience difficulty with timing movements and have less fine motor control. They struggle to find words and may also break up suffixes. The effect is less evident if the person has been drinking for a long time, but the slurred speech results from brain damage. How does alcohol affect the body? Alcohol has adverse effects on the human body on many levels. It dehydrates you, affects your brain, and causes your body to produce more urine. It can also reduce your balance and physical coordination. Too much alcohol can also cause ulcers in the digestive system. Regular consumption of alcohol is also linked to various health problems, including stroke, diabetes, and cardiovascular disease. Drinking alcohol depresses the central nervous system and impacts the area of the brain that produces dopamine, a chemical responsible for feeling good. Alcohol can lead to weight gain and an increase in body fat. Men tend to gain a lot of belly fat, which squeezes their organs and releases harmful chemicals into the bloodstream. Drinking alcohol is not only bad for your body, it can also cause infertility, cessation of menstruation, and breast cancer. The effects of alcohol on the body depend on a person's age, genetic makeup, and family history. For example, People of Asian descent may have fewer active liver enzymes and metabolize alcohol more slowly. Sexual and reproductive health. There is a debate about the effects of alcohol on sexual and reproductive health. In one study, over 8,000 men in several European countries were studied to determine the relationship between alcohol consumption and fertility. If you like this video, please subscribe to the channel. We appreciate the support, thanks. Interestingly, they found no relationship between moderate alcohol consumption and poor reproductive health. However, the study's authors did point out several limitations. First, they did not consider the testosterone level in the participants. Second, they could not rule out the possibility that high alcohol consumption harms a man's sex life. Chronic alcohol and drug abuse are associated with a higher risk of cancer. They can also affect the reproductive system and increase the risk of infections. Furthermore, they may experience abnormalities in their menstrual cycle. Additionally, prolonged amenorrhea may affect a woman's ability to have children. Women should stop drinking alcohol when they become pregnant. It can increase the time it takes to conceive and lower the chances of having a healthy baby. Alcohol can also lead to weight gain, making it more difficult to conceive a child. Women who drink excessively during their pregnancies are also at a higher risk for miscarriage, stillbirth, low birth weight, and fetal alcohol spectrum disorder, FASD. Alcohol and the stomach. Alcohol has many detrimental effects on the stomach. Its main effects include causing gastric acid to increase and inhibiting gastrin secretion. This can damage the stomach immediately and also over the long term. Alcohol consumption increases gastric acid production, but different kinds of alcohol produce different effects. Fermented alcoholic beverages, for example, produce 5 times more acid than unfermented ones. The best treatment for alcohol-induced gastritis is to reduce the amount of alcohol consumed and try to eat plain foods. Try to avoid foods with caffeine and fried foods as they may irritate the stomach. Besides that, staying hydrated is essential. Drinking plenty of water will help the body process toxins more efficiently. It is also a good idea to eat a full meal beforehand. This helps to break down food and soften stool, which helps with constipation. Alcohol irritates the lining of the stomach, which can result in a number of stomach problems, including GERD, gastritis, and ulcers. It can also clog blood vessels and cause bleeding. Alcohol can also increase the risk of stomach cancer. Effects on the renal system. Most substances abused by humans are excreted through the kidneys. The kidneys filter blood to remove waste products and excess fluid. The filtrate is excreted as urine. The urine travels to the bladder and is emptied periodically. Together, the kidneys and bladder keep the blood clean and stabilize electrolytes. Alcohol impairs the kidneys' ability to filter blood. Alcohol is easily filtered and disposed of in small amounts, but too much can cause damage to the kidneys' functions. This can lead to dehydration and malnutrition. As a result, the kidneys have to work overtime to filter the blood. To prevent chronic alcohol use and further kidney damage, it is vital to seek treatment for alcohol abuse. Some Virtava health treatment facilities offer inpatient programs that help individuals overcome their alcohol addiction. While alcohol is legal in every state in the U.S., it should be consumed responsibly. It can affect your health and your life. If you are concerned about alcohol consumption, talk to your healthcare provider. A professional can provide guidance on how to make healthier choices.